The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. We are here to talk to you about the thing that so many of our clients freak out about when they get a positive result, Group B strep. All right, Samantha, take it away.
So, Group B strep, what is it? Group B strep is a really common bacteria that is found in the intestines or the lower genital tract, and somewhere from like 10 to 30% of all adults. In healthy adults, there really aren't any symptoms. We would never really know that it's there or care a whole lot. But in newborns, it can cause serious issues, which means that the people that we are worried about it having it is pregnant people. So
right. It's a colonization of that Group B strep. So if you have a little bit, it's not a big deal and they don't tell you anything about it. You test for it and it's no big deal. You're negative. But if you have a colonization of it, then that's when they worry about it passing to the baby.
Correct. Yeah. So in newborns born to someone who was GBS-positive, meaning that they had a active colonization of that Group B strep bacteria in their lower genital tract. So people in newborns that were born to someone who had that, who did not receive antibiotics in labor, about 1 to 2% of babies will develop something called GBS illness, which can have a lot of complications, including it can be fatal for the newborn. Antibiotics reduce that risk from that 1 to 2% to about 0.1%. So it decreases it by quite a bit.
And I think it's important to say here that we're not saying that you have to get it or that we're judging you. And yes, 1 to 2% sounds like very little, right? Like that's a pretty low statistic. I always say though, when you're the 1%, it feels like 100%. And so we're just telling you the statistics. We're not saying you're a terrible parent if you decide to decline the antibiotics in labor. We have plenty of people that do that.
Exactly. Yeah. I think it's knowing what the risk is, right? Knowing the having informed consent. That's what we're all about, is informed consent. So knowing 1 to 2% of babies can develop this GBS illness, and there are complications that can come up with that. We actually recently had someone whose baby developed GBS illness. They didn't know that baby was sick and just kind of spiked a fever. Took them to the hospital.
And they weren't positive in labor. Pregnancy. Yeah. They did not have a positive GBS test. So that was pretty kind of wild. Yeah. Another thing to consider is...
And baby was fine.
And baby was fine. Yes. Yes, baby was fine. It was a little bit of a whirlwind of a week or two. But, best case scenario. But when I began this and I said that a lot of our people freak out about if they get a positive result, that's that they don't know what that means really. A lot of people are deer in headlights when they get a result like that, and you can't really think about what questions to ask, right? I'm the same way. When I'm in a regular doctor appointment, I forget to ask questions. Oh, yeah. And afterward, I'm like, dang it. Why didn't I think about that when I was in person? That it happens to the best of us, because that's me saying I'm the best of us. But anyways, it's just a saying. I always feel bad when I say that. But when you are getting that result, it is not like a an awful sentence. What they're going to do is they're going to offer you antibiotics in labor. And it's usually every 4 hours once you get to your birthing place or have your midwife come to you. It doesn't preclude you from having a home birth, none of those things. It just means that you're going to have an offer of antibiotics in labor. Usually that's penicillin. Obviously, some people are allergic to penicillin, and so maybe you get offered something different. It's usually an IV, but sometimes not. I've had home birth midwives do it by an intramuscular shot. So it is, the goal is having at least, I think it's 2 rounds of antibiotics every 4 hours before delivery. 1 is like the minimum, but I think that ideally it's 2.
Yeah, I think I've seen some different things on
And
that.
that could be provider specific, because I see that your research has shown that it says 1, but I've also had a lot of providers be very adamant that it's 2.
Yeah.
And so I don't know, kind of where that line lies, but we will also provide some research stuff in the show notes. So if you want to take a deeper dive, you should.
Exactly. Yeah. And I think it's also important to talk about how they even test for group B strep. So this is something that your provider will offer testing for generally at the 36-week mark is when I see that being tested for most often. And the way that they test for it is either they or you can do a swab where they'll have you swab from your anus to your vagina, or sorry, your vagina to your anus. That's it.
We were just testing you. We were just seeing if you were awake.
That's right. So they'll have you swab, and then they will run tests on that, run some labs on it, and see what comes up. And they'll let you know within a few days to a week of what that's looking like. And so
I love that you said that they can do it themselves, because when we say swab, what is that? It's like a giant long Q-tip, right? And so at that 36-week mark, some doctors start offering cervical exams, which you can go back and look at or listen to our cervical check episode. But they will often do this at the same time. They'll do a cervical check and then they'll put the swab in. So you can say, if you don't want a cervical exam and want to make sure that's not happening to you, just say, I want to do my own GBS swab. And you can do that. It's not a problem.
Yeah, absolutely. And if that makes you feel more comfortable, 100%, that's a great option. Some people are like, I don't care, do whatever you're going to do. And that's fine too. So if you test positive for having a colonization of group B strep, how might this affect your plans during labor? So like we said, you will be recommended to have antibiotics. And so what that looks like is if water is broken, if your waters have released when you are in labor, babies might be at a higher risk of contracting that group B strep illness. So antibiotics might be recommended by the provider sooner rather than later, because once that water is released, they are more susceptible to any bacteria that is near them. So sometimes that might mean that they would recommend that you come into your birthing place sooner than what you would if you were, if you were not group B strep positive. There's also the option to come in for those antibiotics and then to return, every 4 hours for consecutive doses. So you don't necessarily have to stay there. I think
people watching online are seeing my face laughing, and that's because it is an unpopular opinion from the hospital staff. They're not going to be amused at your request to do this.
It's a lot more. It's a lot more work. We fully recognize that. It is, they'd have to I don't know, they probably have to redo IVs and do that whole thing every time. I don't know for sure how that would work. That would be kind of up to the providers, but it is an option. Just because it's difficult for them doesn't mean that that's not an option for you. You could choose to leave and come back.
It's not your job to make their job easier. I say that all the time in hypnobirthing classes. It's not your job to make their job easier. If it's what you want, then you should do that.
Exactly. So that is an option. I think, talking about the benefits and the risks of that, you want to go over those benefits and risks of coming in right now versus waiting until a little bit later and what that might look like, because the end result is that we do want you to have multiple doses of those antibiotics within 4 hours of delivery. So if your water is released and this is your second baby, then I mean, we probably do want to start thinking about that, because if you're wanting those antibiotics, once your waters are released and this is your second or third baby's probably coming a little bit sooner. If this is your first baby and your water releases at the very beginning of labor, that is a different story, and we might want to have some more benefits and risks and alternatives conversations with our providers about that.
Yeah. And then laboring at home, like she was saying, you may end up going in earlier because of that. But that's a risk to benefit scenario dependent upon those situations. And you guys, this is another reason why it's so important to have a provider that you trust, because you don't want to be sitting there wondering, do I really need to come in? Because asking those questions of ahead of time of, okay, if I come in because of that, are you now going to want to give me Pitocin? Are you now want to, move things along if I'm not already having super close together waves and blah, blah, blah. So that's something to talk about with them for sure on the what ifs if you do find out that you're GBS positive. And then if you are intending to not have an IV at all, so in a birthing center situation or in a home birth, sometimes, like I said, they can be done intramuscularly, but then other times it is required that it's not required, but like they only have the kind that can be given via IV.
Yeah. Yeah, absolutely. So those options might be a little bit more limited. And it's also, a good time to start thinking about the benefits and risks. Like, do I want a shot every 4 hours, or would I rather just have the IV in my arm so that I don't have to be bugged all the time? So thinking through some of that stuff, things change, and that's okay.
And we have people that decide they know that technically they're supposed to have at least one within 4 hours of birth, which means they don't want you to have the baby until 4 hours after that dose. And then they want to give you another dose. So they kind of want to have those two doses, right? Some people are like, I'm not doing that for 24 hours every 4 hours. I'm just not getting that many antibiotics into my system. I'll consent to one or I'll consent to two. So those people do say, the risk is too high for me to have that many antibiotics in my system. Another thing you can do, and I don't think this was on our list to talk about, but starting to implement probiotics and having probiotics on hand to be giving to your baby to kind of offset that antibiotic pattern and all of the things that come with antibiotics.
Yeah, not necessarily in place of the antibiotics. Probiotics are not going to kill group B strep, but they can absolutely. I think it's because I have heard that. I've heard people say, well, if I have probiotics, then then maybe I can kill the group B strep on my own.
Oh, that's for sure not what I meant.
Research on that is pretty limited. And we'll have in our show notes a link to the evidence-based birth website, and they have a whole thing on group B strep that is really interesting. Gives a lot more detail than what we're giving here today. Highly recommend, if this is something that's interesting to you, you go check that out as well. But that's going to give you some, more in-depth information on like what are all the alternatives out there.
Yeah.
But what would happen if you, decided, hey, I'd rather not have antibiotics in labor? I think it's important to note some countries don't treat group B strep the way that we do here. So there's definitely other options that are out there. Or what if you don't get the antibiotics in time? Your labor is just really fast and you don't have time for them. So in the hospital system, generally baby's going to be monitored a little bit more closely. They're going to do more frequent temperature checks, risk assessments, all those things. In Texas, in the hospital setting, they're likely going to recommend that you stay for 48 hours instead of the standard 36 hours after a vaginal delivery, just so that the pediatrician can, draw labs at that 36-hour mark, because that's when the immediate risk of that group B illness can start developing. So, they'll just kind of keep a closer eye on everybody and make sure everything's going well. But beyond that, there isn't a lot that's happening there, as long as baby's not showing any signs.
Yeah. And I had a client who has now had 2 babies with me, and she has insanely fast births. And her first baby, which no one anticipates that first baby is coming early. Everyone anticipates it will come late. And this baby came prior to 36 weeks. And we said in the beginning of this, you generally get tested at the 36-week mark. And so she was having a birthing center birth. That was the plan, was to get that test at 36 weeks. And she never had time. And her baby received 4 doses of antibiotics within the first 24 hours of life, because that's what they recommended at the hospital. Like, they ended up transferring because of some breathing issues afterward. And she needed just a little bit more care. And they wanted her to have those antibiotics, and they've been dealing with gut issues ever since for them. That's in their mind what's going on. And so that's really difficult. There are going to be offers to you or options given to you, or maybe heavily suggested postpartum if you've had a baby who has been exposed or potentially exposed, but not had any treatment with you as mom or birthing person intravenously through labor. And so you're going to have to that's your first case of advocating for your baby outside of your body in that situation. You may have to do some quick research. And like she said, evidencebasedbirth.com is really great for that. But those are those game time decisions that you're going to have to make. Welcome to parenthood.
Exactly. Yeah. And I think this is where it's really important to have conversations with your provider about, why are they recommending those things? A lot of times we just get like, this is just what we do. But if you kind of probe a little bit more, they are more than happy to have a conversation with you about why they suggest this and what the benefits and risks and alternatives are. It's just that the majority of people aren't asking those questions, so they're not generally answering them to the general public. But if you are wanting more information on these things, push for it. Ask for more information. Talk to the pediatrician. Talk to the OB. Figure out what all these different options might be. We talk about the BRAIN acronym a lot with our doula clients, but always go over what are the benefits of this? What are the risks of this? What are the alternatives? What does my intuition say about this? And what happens if I don't do anything? If I don't do anything that you have suggested? And then taking some space to decide as well is important too. So I think that hopefully gives everyone kind of a good jumping off place for learning a little bit more about Group B strep. There are a lot of resources available out there on this. I think evidence-based birth is a great place to start with that, to make sure that you're getting good, reputable information. And of course, talking to your providers, talking to your trusted birth team, and kind of going from there.
And I also, just one more little thing. I want to make sure that we're not I don't want to be throwing any medical providers under the bus here. Sometimes the baby nurse is often the one that's recommending these things to you or telling you that they need to be done, because they're kind of the middleman between the main provider, either the pediatrician or the OB or whoever, and you. And so sometimes they don't know all of the answers to the questions that you're asking, because they might not be asked those questions very often. They just know this is what we do. And so it's okay to ask for someone else, or it's okay to say, I need more information. So I understand that you can't provide that to me, and that's totally fine. But we need to get in somebody here that can explain these things to me, because that is your right as a parent to be a part of that decision-making process. So I hope that this was really beneficial for you guys, and you got a little bit of information here that may be something that you didn't know before. And we will talk to you guys soon.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.